So this is a follow-up about PRP. We get asked about PRP frequently and whether or not it works. So here's the latest data on that. What we know so far is that it may be beneficial in thickening your endometrium. We don't know if it increases live birth, but there is a suggestion that it can improve things. Previous data on the effect of PRP in the ovary, where we draw it out from you, create the PRP, and then inject it into your ovary, did not demonstrate a benefit. However, in the summertime, a study did come out from some pretty reputable people which suggested there may be a benefit to using it in women that have severe diminished ovarian reserve. How high a benefit? Well, the pregnancy rate was somewhere between 8 to 11%, so it's not a strong benefit. However, for women that were otherwise going to get a 0% success rate, getting that 8 to 11% may be beneficial. Keep in mind, this is not without its risks. First, we have to take a pretty large volume of blood from your body in order to create the PRP. Second, it needs to be injected into a relatively small ovary, which is a hard target to hit, with a very long needle going in transabdominally. This is not always an easy thing to achieve. And third, because it's leaving you and going back into you, no matter how careful we are, there is an infection risk, and that infection could be very dangerous if it enters your bloodstream. So while I applaud the people that are going after this, I do think it A, needs more research, and B, needs to be done very carefully in a highly competent center. We are considering using this, and I am exploring the possibility. It would be fairly expensive. For those that are going to do it, remember, only about 1 in 10 of you are going to benefit, maybe even less, 1 in 12. So is it a valid thing to do when it's got to go through all of those steps? You need the blood draw, you need a injection back inside you, you basically need careful monitoring and anesthetic. Well, I'm not sure, we don't know, but I think it's worth it for those that want to try and are desperate to try for themselves, as long as they can absorb the cost and understand that the yield is very, very modest. It is not a substantial yield. So we don't know for sure on the ovarian injection part. We do know that it can improve the lining thickness. Whether or not that alters your live birth rate, we're still not sure, but they are moving in that direction. I have tried it once, it did not help. So we haven't used it a lot yet in our patients because I'm not 100% convinced in the data, but for the one patient that we used it on, we didn't really see a huge difference. So I'm still trying to figure out if that works in our patient population. I hope that helps. Definitely check out the video. You can find the link here. We talk about all this in that video, but at that point, we did not have the data from the new study, and I'll probably review that in an upcoming Fact or Fiction.